we discuss about maternal autonomy. Okay, so for the maternal autonomy, when you say maternal, you are talking about a pregnant woman. When you are talking about autonomy, you are basically talking about somebody having that, somebody having that. How will I put it? You know, the person is having that freedom to decide, what they want. Okay, so for the maternal autonomy, as in gynecology, it just refers to a woman's right, okay, to make informed, voluntary decisions about her own baby, about her own body, health, medical care, you know, even her baby. Okay, so you shouldn't force her to follow your own, okay, rules, but there's a room to advise her though. Okay, this is especially during childbirth, pregnancy, postpartum. So it's a cornerstone of ethical healthcare, all right, and reproductive rights, emphasizing bodily integrity, personal freedom, and respect for individual choices. Okay, so why does this concept actually matter in gynecology? It ensures that women can accept or refuse medical interventions. If you want to do a medical intervention for a woman, you should be able to explain to her what will happen to her body, why she needs it. If she says no, okay, and maybe you can bring in some one or two family members. I don't really know though. Alright, but the decision is solely hers to say yes. Alright. So it also supports what? Informed consent and shared decision making. It protects against coercion, especially in vulnerable moments like labor. When in labor she's helpless and stuff like that, you don't just do what you want to do to her. Okay, before the labor you must have explained everything to her. Okay, then balances maternal rights with fetal consideration in ethical complex situations. Of course you can advise her, but not force. Okay, so maternal autonomy, you just have to do it informed consent. Okay, she should do everything voluntarily. Okay, competence, then disclosure. You must be able to explain things to her. All right, so legal and ethical tensions is this: in some cases providers may feel compelled to override maternal choices for the safety of the baby. Okay, legal systems vary in how they balance what the mother can decide and what will benefit the baby. Okay, so it just depends on where you find yourself. This is just like a startup lecture to it. Okay, you still combine this with the rules of where you find yourself. Studies show inconsistent support among care providers for maternal decision making. So in many regions, education, income, and access to care influence a woman's autonomy. Okay, cultural norms and patriarchal structures may limit decision making. So the whole thing is this. Okay, a woman will make decisions only if she knows that those decisions exist. Okay, so in our world today, as women are getting more educated, this is now becoming more a thing, because you have mothers that are educated. They have used goggles to check one or two things, so they might actually want to make decisions too. So that's it for maternal autonomy.